Good evening, everyone. On tonight's awareness episode, we will be talking about cerebral palsy. Did you know that cerebral palsy affects 1 in 278 children? Cerebral palsy is a disorder that causes problems with muscle coordination and or other disabilities. Tonight, we have special guest, Kobe Allen. Hi, Kobe. Nice to have you here tonight.
Pleasure to be here.
Kobe was diagnosed with cerebral palsy at 15 months. We'll go to him with some facts about occurrence.
While it is common, cerebral palsy afflicts more people than you think. At least 764,000 people are affected with cerebral palsy in the United States, and every year 8,000 babies are diagnosed with cerebral palsy.
Diagnosis of CP is through different types of screening. Developmental screening tests are given at 9 months, 18 months, then again at 24 or 30 months at the usual doctor checkups. The doctor looks at motor skills, muscle tone, reflexes, and posture. Some signs at a young age might be his or her legs becoming stiff when picking him up, or crawling and sitting up with only one side of their body. It is important, if a parent notices any of these things, to contact a doctor right away.
Cerebral, meaning the brain, and palsy, which refers to the impairment of motor functions, is caused by a brain injury that occurs during pregnancy. It usually occurs in the early stages of the pregnancy, sometimes during delivery, and in rare cases, in the early years of a child's life. Cerebral palsy targets the cerebral cortex, which controls muscle movements. Genetics, bleeding of the brain, prenatal infections, head injuries, and shaken baby syndrome are all possible causes of cerebral palsy.
Medications that can lessen the tightness of muscles may be used to improve functional abilities, treat pain, and manage complications related to other cerebral palsy symptoms. Physical therapy can help the patient's strength, flexibility, balance, motor development, and mobility. They do this by stretching stiff muscles and muscle training exercises. Occupational therapy is used to help patients practice alternative strategies and adaptive equipment. This helps promote independent participation in daily activities. Speech and language therapy is used to help patients properly communicate with different strategies such as a computer voice synthesizer and sign language. Some patients benefit from recreational therapies like therapeutic horseback riding. Currently, there is no cure for cerebral palsy, but there are many treatment options to help it become more manageable over time. Children and adults with cerebral palsy require long-term care with a medical care team. Many members of this team may include pediatrician, pediatric neurologist, orthopedic surgeon, occupational therapist, speech-language pathologist, and developmental therapist. Some of these treatment methods can include medication, physical therapy, occupational therapy, speech and language therapy, recreational therapy, and surgery.
We're back on awareness episodes. Kobe, what's it like having CP?
Well, to be honest, in CP has kind of felt like it was a pain for me, to be honest, and it made me feel like a split personality, so to speak, because with my spasticity cerebral palsy, the left side of my body doesn't function as properly as the average human being. I think when I was little, my left canine tooth was twisted, so to speak, and whenever I clear my vision without my glasses, my left eye gets kind of lazy, as you can see.
So Kobe, what were your treatment plans?
I think my OT and PT treatments helped me quite fine, and my special education, it helped me a lot to get through high school and such, and it's how I got to college, and I'm very thankful for that.
What did your OT and PT do specifically for you?
Well, specifically, in my OT and PT, he improved my mobility and my speed, because I couldn't get around fast enough, so I was always slow.
So Kobe, you've mentioned you've had a few surgeries?
Well, it's true, Kinsey. I've had a few surgeries under my belt, so to speak, and when I was 3 years old, I actually had to get surgery on my left leg because my foot kept turning in every time I took a step. And yeah, so later in 2010, I had to get surgery on my left leg again because my muscles kept tightening up under my left leg.
And all those are problems on your left side of your body?
Yeah, because as I mentioned before, the left side of my body is not as functional.
Thank you for joining us tonight, Kobe, on the Awareness Project episodes.
I'm glad I could provide some info on the cerebral palsy.
It was interesting to hear your story. Is there anything else you'd like to share with the audience?
CP is not curable, but it can be treated. If you know someone who has cerebral palsy, call a doctor right away.
Catch us next week for another awareness video.